So on Saturday I'm speaking at the Assert conference. So they have an annual conference. It's a conference focusing specifically and supporting families who have children and support people with Angelman Syndrome. I have worked with some children in my past who have Angelman Syndrome, and I have also been speaking to some families recently and asking them specifically about which sensory aspects would they like to understand better. And so I've just picked out a few of the sensory characteristics which most of us are familiar with, and I'm just going to specifically relate them with Angelman Syndrome and what we can understand by these characteristics. Okay, so lots of tight hugging. It's likely if you know someone with Angelman Syndrome, they will love to give you a big squeeze, or when they are holding on to you, they are giving you that really tight, firm hug. So when we're getting and giving a firm, snug hug, we're getting lots of proprioceptive input, so lots of body awareness. We're getting lots of tactile input because we're feeling that texture on our skin. It also could be giving them extra smell input. So don't forget that smell is a really common processing difficulty, but one which often is hidden amongst other characteristics, so we might not pick that one out as being identified first. So big tight hugs may well be for a proprioceptive seeker, a tactile seeker, but also a smell seeker. Chewing on things, so maybe chewing on clothes, so chewing on collars, chewing on sleeves, maybe chewing on objects, so anything that we can find, maybe pens, things like that. Again, lots of body awareness. When we're using our joints and our muscles, that's our proprioceptive sense that's telling us where we are. So when we're chewing on things, and we really are chewing, that's helping us to concentrate because it's bringing all of our senses to work together. That's our sensory integration. But when I'm chewing, that's the input that my body is requiring at that moment in time. So it could be, again, I'm looking for lots of extra proprioceptive input, so body awareness input. That feeling, that achy feeling in my jaw is lots of muscular use. Tactile, it may well be that object's really rough or really smooth, and so I'm getting lots more tactile input by chewing on something as well. Now I know a lot of children that absolutely love water. It might just be that they love flickering and splashing and playing with bubbles in water, or it might be that they love to get in the water themselves, so going swimming and having paddling pools. When we're swimming, again, it's brilliant for our proprioceptive sense, our body awareness. So it tells us when we're underwater where our body is, because we can feel it. The water is wrapped around us like a big hug. It's exactly the same for when we're lying in a bath. So you've probably seen my video about the differences between a shower and having a bath. That bath is really great for lots of proprioceptive, that body awareness input. It can tell me exactly where I am. Water's also really great for lots of visual information, so it's really reflective, so we get lots of lovely patterns, but also when we're flickering it, we've got that movement as well as the visual, which is going to be really stimulating for people who seek vestibular, so the movement input as well as visual input. Touching things. So when I used to take some of the children I supported to maybe a new soft play area or a new park, some of the children would spend a little while just walking around the area, touching things, pushing things, seeing how they felt, seeing how they worked, if they could climb on things, really trying to suss out the area. Now for someone who constantly touches things, whether it's just tapping someone next to them or whether it's fidgeting around and picking up things that are in front of them or walking around tapping and touching things, again, that can be lots of proprioceptive input. So telling me, where am I in this space? So, oh yeah, I know that there's a door there, so I can push that door. Oh, I know that there's a table there, so I know that I can bang my hands on the table. And that table is giving me lots of information about where my body is, where my hands are. When I'm going around squeezing things, I'm working out how hard or how soft things are. It might be tactile, so I might be a tactile seeker. I'm looking for lots of extra textures to give me more information about where I am in space, so the proprioceptive sense, as well as that rough and that smooth consistency. And on the side of that, we then might recognise that some people may well break things quite easily. They may well just squeeze something and not realise how tight they've squeezed it. Or they may well push something and not realise how hard, how much force they've used to push it. Again, that's lots of body awareness, proprioceptive sense, but also it's telling me about where my space is around me. When I throw something, if I throw something with force, then that's my discrimination side of my proprioceptive sense. So I find it difficult to know how much force and pressure to use to be able to use that toy or use that object without breaking it. Maybe I pick up a cup and I squeeze it, or I tilt it and then the drink spills out. That's again my proprioceptive, my muscles and my joints, and their messages that they're telling me of how to use that skill that I'm doing. So if someone's breaking things easily because they're squeezing things or they're throwing things, or that maybe they stand on things, again, that can be proprioceptive. It can also be tactile. It may well be the vestibular, so the sense of movement. And don't forget, our vestibular joins in with our visual sense. So we rely on the two to give us that sense of movement. If you think when you're traveling in a car, you have that feeling that you're moving, but also you have the visual, which gives you that information that you're moving as well. So just running over some of those characteristics, we've got hugging people, we've got chewing on things, we've got loving water, we've got touching things, we've got maybe squeezing things really firmly. All of those things can be related to similar senses. So our proprioceptive sense, maybe they are requiring lots of extra input about where their body is in space. And when they're doing that, maybe that really firm squeeze helps them to know where they are. On the other side, it may well be that maybe they're not quite confident in knowing how much force and pressure they are using. So when they are giving you a hug, maybe they don't recognise that they're squeezing you really tight, because for them, that's the amount of information that their body needs. So all of those things could be proprioceptive based. Most of them can also be tactile based, and we know that tactile is our largest external sense. Our proprioceptive sense is an internal sense. And then another characteristic which lots of people wanted me to mention was also the fact that they might not necessarily need much sleep. So it might be that someone wakes up really early in the morning, or maybe finds it very difficult to go to sleep at night. Now, I've got a separate video about bedtime and evening routines and why we might think that someone's finding it difficult to fall asleep. But within this situation, we know that also people with Angelman Syndrome may express their emotions in more of an obvious way. So we know that they may well seem happy, or they may well seem frustrated or agitated more. And those emotions, we can't forget our interoceptive sense, so that internal sense, which we know lots of people are starting to talk about more, which is brilliant. That internal sense are our feelings of hunger and tiredness, when we need to go to the toilet, when we're thirsty. That sensory system gives us lots of information. We respond to it emotionally. So like I've mentioned on other videos before, when some people are really hungry, they may well get angry, and we might refer to that as being hangry. If we're thinking about sleep, don't forget that when I'm more tired, maybe my emotion's a little bit more sensitive, or maybe I express myself in a different way. So when we're thinking about people that may well sleep less, they may well seem to be able to function and to regulate themselves amazingly throughout the day and their senses, and be able to concentrate. But then maybe small changes. So we're thinking about a threshold, so a small threshold and a really low threshold can mean that a little change can mean that someone may well emotionally respond to that in a way which we may well find difficult to understand because we don't respond in such an emotional way. So let's think about all of those characteristics. I've emphasised our proprioceptive, so lots of body awareness and lots of tactile, both seeking and maybe avoiding certain kinds of textures, maybe discrimination difficulties with our proprioceptive sense as well. Some of them are probably smell related as well, so when we're loving water, if we love water without any scent to it, maybe that's our way of regulating, being able to manage and block out all of those other smells around us which are really overwhelming at that moment in time. So those are just some characteristics that I just wanted to run over before I speak at the conference, and for the rest of you to share and to make sure that other people are understanding the importance of breaking down these characteristics relating to sensory processing disorder.